Afternoon, everyone.
Good afternoon.
Hi.
Afternoon.
And apologies, this isn't my bedroom. In case people were wondering, I'm in a hotel room, so apologies. Yeah, not normally the backdrop. Let's just give it a couple more seconds and we'll make a start. And thank you, Sarah. Good to see Sarah's joined, because I'm sure there may be some questions in relation to the fantastic news, I'm going to say, that I believe has come out today whilst I've been travelling to Liverpool. So a really key moment, I think, isn't it? So, but we'll come on to that. I think, Chris, shall we start? We've got I think there's a fair few people that have managed to join us.
Yeah, I think we're a couple of minutes past 4, Stacey, now. Obviously, delaying it to a later time than usual has possibly affected the numbers, but hopefully a few more will join. Yeah,
and again, apologies, folks. I know it's not an ideal time for people, but as you will see, that's why we delayed it, so I could try and get to Liverpool before the traffic hit, although it didn't work. So I think whenever time I'd have chosen to come, I think I'd have still hit traffic. So okay, brilliant. Thanks all, and thanks for joining. As always, just some key areas to update with, and importantly, opportunity to hear from yourselves as well, or anything that I say, any triggers, any questions or concerns, please do pop your hand up or pop it in the chat, and Chris will help me navigate through that. So first of all, I think I welcome to IPC and the COVID changes, again, because it may be creating some anxiety for some people, and for others, I'm sure it's a real feels like a real key moment in what's been two and a half years of managing this. So Sarah, shall I hand over? Is it easier, because you've probably spoken about this numerous times, so if I can hand over to you first, that would be really helpful. Thank you.
Yeah, no problem. Thanks, Stacey. And I think staff will all be aware that some new guidance landed on the 1st of June, specifically in relation to mask wearing within hospitals and social distancing. So hopefully you've all seen sight of the comms that we've issued earlier today. But as an SLG, we made the decision to enact the national guidance, notwithstanding our outpatient departments needing further review, but I'll come on to that in a moment. I just want to start off by saying that this is a real step change, and for all staff and patients that still want to wear masks, please be assured that we're not taking masks away. You can still, if that's your preference to do so, please wear a mask. Do whatever makes you feel safe and comfortable to be at work. So as I said, from today, in non-clinical areas, non-patient facing areas, you no longer have to wear masks. Social distancing isn't mandated, but we are asking people to be respectful and considerate of people's space, and just be practical about things, really. From Monday, from the 20th onwards, in our inpatient areas, again, you no longer have to wear masks unless you are giving direct clinical care for suspected or confirmed patients with respiratory illness. So that could be flu, it could be RSV, or it could be COVID. So it's really important that it's that respiratory illness, not just COVID. It's also really important to say that if there are any individual patients that are immunocompromised, that again, you would be expected to wear a face mask in that instance to protect them. So we will be out and about this week, engaging teams, making sure signage is visible, and answering any questions staff may have on the run up to those changes on Monday. In line with that, we are opening our visiting back up to all inpatient areas. So as you know, at the moment, we have got visiting on Oswald, MCSI and Sheldon. It's a booked system, and we will be moving to that system for our MSK wards. They can have more than one visitor, but again, visitors don't have to wear masks until and unless again the patient that they're visiting has got those respiratory symptoms or got confirmed flu or COVID. In our outpatient department, we're having to do slightly more detailed risk assessments because we don't know the patients that are coming through our doors. So we have got cohorts of patients like our rheumatology patients that might be clinically vulnerable, some of our children that are seen in children's outpatients. So we're having to do individual risk assessments for those areas. So we will be issuing further comms out and coming to talk to the teams directly. So please bear with us with that. If you can continue to wear face masks in outpatient areas for now. We are asking our patients that attend to still wear face masks where possible. We know some will choose not to, but yeah, just please bear with us whilst we work that through. I think that's it. I guess my plea to everyone is it's great news that we're moving forwards, but to keep us safe, be mindful about respiratory symptoms. If you're not feeling particularly well, make sure you do a lateral flow test and don't attend work if you're not feeling well. Continue your twice weekly testing. That's really important. That is still picking up some asymptomatic cases, and good ventilation. So fortunately this week we've got great weather. We're heading into summer, so make sure your doors and windows are open in the departments and areas that you're working in. I think that's it, Stacey. Sorry, I've rambled on a bit, but I'm hopefully that's clear. I have had a few individual messages which I'll be responding to in due course, but again, happy to take questions here or be emailed directly.
Brilliant. Thanks, Sarah. Yeah, really clear, really comprehensive, and you know, you're the other person that sits on my shoulder, me getting overexcited and. But yeah, it'd be great to see people's faces, everybody's full face again. Really looking forward to that. So any questions for Sarah or any concerns? So anything in the chat?
Not yet, Stacey, no.
Okay, I think it's Liz.
Hi, I'm just wondering what effect or is this going to have on working from home? What are we going to say different things to staff, or are we remaining as we are in terms of? I'm just thinking about social distancing. You know, sort of what does this mean for staff? Because I'm sure we're going to have those questions.
Yeah, listen, I think I've updated previously. It's a really good question, and it's the right question to ask. As part of our commitment to flexible working, you know, for some people working from home suits them, and I wouldn't want to change that. But I also want to make sure that we've got the right facilities, comfortable facilities for staff on site as well. And I started the estates team with Craig leading it. I started looking at the priority areas being rest space. Have staff got space to rest? And again, looking at our meeting room. They're the two elements we were looking at first. We will then move through, Liz, to office space. What have we repurposed? What do we need to do? So we're taking a bit of a logical flow through that to therefore then be able to say, you know, this is our stance. But I don't want to take it away from people it suits their work-life balance. They can absolutely fulfil their role working from home. So I don't believe we'll ever be back to, you know, what we did pre-COVID. I think there'll be choice as well within that. For some it works. For some it works really, really well. So yeah, but as I say, we will put more communications out once we've worked through that piece of work. But yeah, good question. Thank you. Have we got anything else in the? I think there's something in the chat. I can't.
I've just responded to a question from Victoria about training rooms, because we're risk assessing and reviewing them in terms of their ventilation, but we're likely to put them down to 1 meters without masks with good ventilation. But our health and safety advisor and the IPC team are working through that. So you'll see updated kind of maximum occupancy signage for those shared shared training facilities. And I think Jack has asked about individual staff that might be high risk themselves, and so we're liaising with our HRBPs and line managers, but it's that individual staff risk assessment with your line manager. What will keep you safe at work, and those conversations need to happen. Really, we've recently updated the risk assessment to have those conversations. So have them with your line manager. But happy to support where necessary if advice is needed.
Okay, thanks, Sarah. It might be worth us again putting out in comms, isn't it, that the individual risk assessment and the process again, just to remind people, because absolutely that's key as well. We don't lose. We're talking about clinically vulnerable staff, but patients, but it's just as important, isn't it, that we might have to make adaptations for our staff as well. Let's have a look. Just if there's anything.
There's just one more question just come in, Stacey, from Bobby Claxton, who's asking, he's curious what the rules are for the receptionists on main reception and radiology. I suppose they're in that area where they're in the main entrance where the rules don't apply, but they're right next to outpatients where we are still saying masks. So probably for that small group, can we be clear on what we expect from them?
Yeah, I'm sure I know what Sarah's going to say, but I'll let her come in.
I think because it's a patient-facing role and it's the patients entering outpatients, we're asking you to wear masks at the minute whilst we work through that. So yeah, thanks, Bobby. And if the team want to chat with me, happy to do so. But we'll work it through this week. Those are the kind of nuances that we have to do for our outpatient areas. So
yeah. Okay. I think we've captured, haven't we? Yeah, I think we've captured all the questions, but if people think of any, just pop them in the chat and we'll come back to them. But yeah, thank you. Thanks, Sarah. Okay, just in relation to IPC, obviously not COVID, but I've given updates, haven't I, during the last few months around where we're up to following the outbreaks that we had back in the summer last year. And we know Jacqueline Barnes kindly working with us to make them improvements. So again, just to update really from a trust perspective, you know, some really positive, significant improvements. The plan is looking good. We seem to be on track on the whole for all the actions that we needed to address. So actions are what we needed to address along the themes. I think the 9 themes that I've previously updated people on. But really good to see, really good progress in relation to that. Just linked to that, and I think it came out in comms this week, there's been a lot of work, a lot of discussions, conversations around uniform and dress code. I'm sure I saw something this week, so I think the comms have already gone out to the organisation. But as part of the engagement and the conversations we've had with individuals, different staff groups, different professions, we're really looking at our uniform policy, which I believe is fairly imminent, isn't it, Sarah? That we're hoping to publish that really, but with some additional, you know, we'll make sure that there's some key comms around any changes within that policy. I think the key thing and the message, and we had again discussion at SLG this morning to ensure that we've got adequate changing facilities for staff. But you know, one good element and one of the learnings from COVID was how we, you know, took the decision to make sure we changed both when we got to work and before we left work, especially those wearing, well, for those wearing clinical uniforms. And that's something that we want to keep. It's good practice. It's practice that's evident in other organisations from an IPC, so not just COVID, but for other infections. So that's something that we really want to keep. But again, make sure it's, you know, staff have got appropriate facilities, etc. But also our policy is really, really clear. So you just watch out for that, and if you do get stopped or engage in any sorts of conversations, please give us your honest feedback around some of this, because we want to make sure we get the policy right, and if we can get the engagement and we can get it right, we're likely to have a good chance of implementing it and people adhering to the policy. So a bit of a watch this space in relation to that. So I think that's it from an IPC perspective. Couple of other things just to update people on. We've mentioned previously about our Cqc preparation. That work is still ongoing, and we've got the Good Governance Institute in to support us with that piece of work around our preparation, helping us with our narrative, outlining our journey since the last inspection, and also what we've done over COVID as well. I'd really encourage everybody within your wards, departments, etc., to have conversations about what you're proud of, what's the things you're proud of, what's the things we could do better at. Really have them conversations, because they're the sorts of things that the CQC, when they come in, will be asking staff. The other area we're looking at is around some of the areas that we just need to strengthen. And EDI is one element of that. The other is our freedom to speak up. So we have a process. We've had a process for some time. We've got our freedom to speak up guardian, but we've really looked at just some feedback that we've had from staff when we've looked at the staff survey results. What could we do something better than what we've currently got? And that's not critical of what we've got, but it's just how do we make it easier and staff feel able, if they've gone through their own line management or higher and still don't feel they're being listened to, or things have been enacted, how can we give staff another opportunity, another sort of signpost to be able to do that? So we've been doing a lot of work, a lot of conversation. So we are looking at relaunching our freedom to speak up, our approach to it, that is going to look slightly different. So again, watch this space, but really key, freedom to speak up should be the last resort. We should feel able to speak up to anybody, but ultimately, we should be going to our line manager in the first instance. But sometimes, for right reasons, that's not always easy for staff to be able to do. So it's right that we've got other support out there that can guide staff through any areas of patient safety or concern that they may have. As part of our CQC preparation, we've had a few conversations around what we believe the Trust's top risks are. And I know as a board we've done this conversation. Kindly, the last managers briefing, we had a conversation. So just different forums that we're into, just trying to get people to think about what they believe the top risks of the organisation are. Just to outline, just very, very briefly, and people may interpret these slightly different depending on where you work. So it's not about people articulating it all in the same way. It's very different depending on where you work or your profession, as an example. But certainly from a trust perspective, long waits and our backlog has to be our top risk, or feels like that is our top risk. That's one of our top priorities, doing everything we can possibly do to treat and care for our patients, especially considering the numbers that we've now got and the potential harm patients can come to whilst waiting to get access to our services. The other area of risk, which I've just touched on from an IPC perspective, both in relation to the risk to patient harm, but also from a reputational perspective for the organisation, considering the scrutiny that we're under from our regulators in relation to that. And then the third one, we've sort of badged as capacity, but that means, for me, that means not just buildings, that means workforce. Have we got the right numbers of workforce with the right skills, the right development to be able to treat the patients that we know we need to treat? So when I say capacity, I don't just mean physical space, etc. It's certainly wider than that. So again, just thought it'd be helpful for people just to be, and just to give thought. But as I say, I'm sure in different departments you'll have different risks, but certainly from a trust perspective, they were the three, along with others. But certainly if we're just looking at our sort of top three, that was what we came up with. And again, I think as part of CQC preparation, again, they're the sorts of things within your wards, departments that they'll be asking you, what do you believe your risks are within the place that you work? Okay, Just a couple of other things. Again, in comms this week, you'll have seen the People Pulse survey, and encouragement really for staff to take part in that. And we've spoke previously around our staff survey, and we had some positive. There was positive within it, but there was some really key areas of focus that we've started some work, but there's a lot more work we need to do as a trust to improve your working lives and environments that you're working in. So the pulse survey would be really helpful to get a sense check, hence it's called a pulse survey. It's you know, a certain time that it's done, but it's done on a more regular basis as opposed to the staff survey being once a year. So just an encouragement and a bit of a plea from me. Please do. It takes five minutes. It's not like the staff survey. It's not as in depth. That's much shorter. But it would really give us an idea around how staff feel now. Staff survey was done obviously last November. That's not to say the results from that aren't relevant. I'm sure they absolutely still are. But it gives us that sense check. And if we continue to take part in the pulse survey, we should start to see when we're implementing more changes and improvements, are we getting it right? Or actually are we going down a rabbit warren and maybe need to do something differently? It's a bit of an encouragement there, please, to do take part. Other thing I just wanted to say again that went out in comms this week, totally different, but as people may or may not be aware, this month is Pride Month, very close to home for me. So a month that absolutely should be celebrated from an LGBTQ plus perspective. And we all know, well, I certainly know at Robert Jones, people like to get the children involved. So we were trying to think of a way that we could get staff's children involved. So there's the Pride themed T-shirt competition. Again, a bit of fun, get the children involved. Apparently I can't do one because I'm not under 16, unfortunately. So but yeah, and then I think, isn't it, I believe the winning T-shirt will be made into a proper T-shirt and be showcased at an event near the end of the month where we're going to unveil the new Pride Progress flag outside the front of the trust. So just an opportunity, staff to get together, etc., and we'll do something in relation to that. So please do encourage the kids to get involved. And then the last point, because again, mindful, I've been talking at you and want to have the opportunity to hear from you. The other work that we've been heavily focusing on, as well as the here and now and the backlog and the IPC challenges, but you know, our role as the board is to very much look to the future for the organisation as well as the here and now. So lots of work around our corporate objectives for the next sort of 12 months, maybe longer. And again, just to give you a bit of a flavour around what they are, we're going to be doing some cascade sessions, certainly within the units. We spoke about it again at our senior leadership team meeting this morning around how we bring these to life for different departments, different staff groups, etc. And some may be involved with many of them. For some of you, maybe one or two. But there's 5 key corporate objectives for this year. Of course, the first one, maintaining our statutory and regulatory requirements. It sounds very, long-winded, but it's basically, our patient safety and standards of care. So whether that be CQC, whether that be NHSEI, and of course that will incorporate the improvements from an infection prevention and control perspective. I can see Simon in my eye line. Next one being the digital focus. And of course, why wouldn't we, when we've just had the great news that we've had the go ahead with the funding for our EPR. So this objective, of course, it is around implementing our EPR, but it is wider. It's more around how do we optimise the digital world. And within that, I also mean that training, education, awareness. For some of us that aren't very digitally minded, I can just about find my way through a Word document Don't give me Excel, can't utilise that at all. But this is more around apps, and this is also about how we interact with patients, more patient-facing apps, etc. So really exciting times. The other one is around ensuring reviewing our clinical services, and the purpose of that is we need a clinical strategy. What's the forward thinking from a clinical perspective for the organisation? And you can't really do that until you've reviewed all our clinical services. So again, that will involve getting people together around what works really well, what could we do better, to make sure that we've got everything that we need for all our clinical services. MSK. And this links to us working across the integrated care system, but around how do we optimise and support MSK integration across the system? How do we make it the best for the population that we serve? And then finally, of course, we've got a great new building that's going up at speed in front of our eyes. So it's around the veterans and development of that service. Great that we're going to have a great facility, but it's around how we grow the veteran service for Robert Jones and Agnes Hunt. So some really exciting stuff, and it's important that we've had 2.5 years of in the here and now with COVID, so it's right that we start to look ahead for the future. So look forward to talking in more detail to some of you around some of these objectives, and certainly within the units and your own teams as well, getting more involved, more engaged. They're not set in stone, they're the high level headings, so we want to make sure we do the engagement and get people involved within them. So I think that's it from me. I think I've talked for way too long. Anything in the chat, Chris? Or anybody wants to pop their hand up? Any questions, either on anything I've said or anything else?
No, the chat's no, Stacey, nothing new in the chat. No hands up that I can see at the minute. So just encourage people. We're coming towards the end of the session, but this is your chance to ask some questions if you've got any. And obviously, we've had a few about the IPC, and there's been a few questions that Sarah's responded to in the chat. So encourage people to have a look at the chat as well, where there's some answers to some maybe key questions that you've been thinking about yourselves. So the answers are in there if you go and have a look. But other than that, Stacey, no, we don't seem to have any fresh questions today.
Okay, it seems to be quite a lot of information given today. So apologies for that. Oh, Bobby's popped his hand up.
Hello, yeah, my apologies. I did put something in the chat, but it doesn't look as if it's come through. But I've got a super important question and wondered whether or not we can have departmental buffets. What's the buffet policy currently at?
Oh, see, I haven't even thought about that one, Bobby.
That's a very important question, Bobby.
It is, it truly is. If we was to kind of do 1 meter distancing and whatnot to please everybody, can we bring in the cocktail sausages and stuff like that? Is that all right?
I think 1 meter social distancing, good ventilation, good hand hygiene as well, please. But yeah, we've got to be practical about this and move forward. So good question.
Very good. Thank you so much. Very good news.
I think you got the right answer, Bobby.
Was that the right answer? Yeah, just checking.
Definitely was. Yeah, definitely was.
Yeah. Just make sure we get an invite, Bobby, please. Okay. Thank you. Thumbs up. That's good. Any other questions? No.
It doesn't look like it, Stacey, although my team seems to be working on delay today because questions are appearing, and Bobby's question is there, but I haven't seen it. So I apologise that I missed that, Bobby. But no, if there's nothing else, Stacey, I think cocktail sausages is as good a place as any to finish.
To end it.
It's a brilliant way to end it. Absolutely. So, thank you all. Really appreciate everything everybody's doing. We yesterday signed off our annual accounts and annual report. There may be some people on here that were heavily involved in that, so we don't underestimate the amount of work that goes into producing that. So if there are people on the call today, huge thank you for that. But yeah, And for those who weren't, thank you to everyone as well. Keep up the good work. There's some, you know, it's getting more positive. Let's get morale up, isn't it? And move forward without a face mask on. So look forward to seeing some smiley faces when I'm back in the trust on Friday. So thank you. Take care.
Thank you.
Bye all.
Bye.